Hello, and welcome to the Road to Becoming a POCUS Champion. I'm Jenny Miner, a project manager with STFM, and we are excited to have this webinar as the kickoff to our POCUS application opening today in our POCUS program. So joining us today are Ryan Paulus and Puja Dalal, who are here to tell you about POCUS in family medicine, and also our Family Medicine POCUS Educators Certificate Program.
Thanks, Jenny. Thank you, everyone, for taking some time out of your day today to listen to this. And thank you to everyone who will be listening to it later on the recording. Super excited about ultrasound and very thankful to have the opportunity to talk to you all today about the road to becoming a POCUS champion and other things related to family medicine, point of care ultrasound education. What we'll do here first is Puja and I will introduce ourselves, and we'll kind of go into the rest of the webinar. So a little bit about me. I graduated med school in 2019. Right when I was leaving medical school, or school was getting some cart-based machines to start integrating it into their education. Did residency at UNC from 2019 to 2022. And it was my intern year with the handheld ultrasound machine when I was first kind of really introduced to POCUS and got hooked right away. As a resident, I helped formalize and develop our residency didactic curriculum. After residency, I joined faculty, where I'm our faculty lead at UNC for POCUS training, developed an area of concentration for our residents, elective training, working on upscaling faculty, and just other scholarly work around POCUS. Most of my clinical work is around hospital-related stuff, so I work half my time at UNC's critical access hospital in the ER, where residents will come do a lot of ultrasound with me. And I also spend the other half of my time as a family medicine inpatient attending on our inpatient service. And then earlier this year, I pitched an idea to the STFM board about, hey, we need a longitudinal family medicine certificate program in point of care ultrasound. They were super excited and supportive and kind of gave the go ahead in the project. So we've been working that a ton over the last several months, and I'm going to be very excited to talk to you all about it at the end of this webinar.
Hey everyone, it's good to be here. So a little bit about me. My name is Puja Dalal. I graduated from medical school in 2014 from the University of South Carolina, which is where I mostly grew up. I did residency at Swedish Versatile out in Seattle, Washington from 2014 to 2017. I worked for a few years afterwards, and I went back and did a primary care point of care ultrasound fellowship at the University of South Carolina in Columbia, South Carolina from 2020 to 2021. And then that brings me to my current position as core faculty at the Novant Health Family Medicine Residency Program, where I am the director of POCUS. The reason I decided to even do a POCUS fellowship is pretty simple. I wanted to increase access to high quality medical care for my patients. Before I did the fellowship, I was working at a CHC in the greater Seattle area. Most of my patients were refugees with Medicaid that really just couldn't get access to specialists, or the wait time was really long. They had difficult time getting any form of imaging. I was doing the best I could at being a family medicine doctor, but I also was being a cardiologist and a nephrologist and endocrinologist. I'm sure other people here probably have similar experiences. Then I kind of found out more about POCUS through a colleague of mine who's doing a fellowship, and I looked into it and realized that I really wanted to learn this skill, really just to increase access to high quality medical care, like I stated before. Originally, I thought I would just use it in my practice in an outpatient setting at an FQHC or a CHC, but I quickly realized that teaching is really the best way to improve that, and I think that's why all of us are here right now. Brian?
Awesome. Yep. So we'll talk a little bit now about the objectives that we'll cover today, then we'll kind of get right into it. So we're going to talk about the importance of POCUS in family medicine, residency education, the need for POCUS champions, which is really going to kind of segue into the ACGME guidelines regarding POCUS education. And then from there, how are you going to get your faculty trained up, how you can get your residents trained up, all in point of care ultrasound. And then we'll finish today talking about some of the new resources that STFM offers for point of care ultrasound education. Before we get started, just to kind of get a sense of who our audience is here, if you guys don't mind, just kind of listing there A through E of like what your position is, so we can kind of see who's here today. Looks like we might have some issues with the poll. Yeah, some people are kind of filling there in the Q&A. So it looks like we're having a little mix of GME faculty, residents. Yeah, sorry guys, the poll's not launching today. But I'm getting on the Q&A here. Some people are chiming in. So looks like we're having mainly a med student. Thanks for joining. So I have a little kind of mix of everything here. A lot of GME faculty. Awesome. Cool. All right. Could you just go to the next one? I guess if the poll, see if the poll doesn't pull up on this one, we can also just skip this. There we go. The poll just popped up on my screen, so hopefully it all popped up for you all.
I think we can launch the answers now.
Okay, nice. So again, a little bit mixed. Not surprised, and more like majority right now, like we're still learning ultrasound a ton and trying to integrate it clinically. So the majority don't integrate it yet. The next is they do it once a month, and then the followed by once a week. Then there's some people that order it 3 times a week and sometimes 5 times a week. So definitely got a mix there. Awesome. Well, that's good. And a lot of people can benefit from the end when we talk about some of the resources to help help you guys integrate it more weekly and more daily into your clinical care. You can go to the next one. Perfect. And again, if it doesn't pull up here, we can skip it, but hopefully it works since the last one worked. All right, it pulled up on my screen, so hopefully it's working for everybody else.
Okay, I think we can watch the results.
Cool. Nice. Yeah, a lot of POCUS champions here. Awesome. Well, hopefully you guys can, for those of you who are POCUS champions, hopefully you can pick some stuff up today that kind of improves your skills as a champion. And those who are not yet, you hopefully can pick some tips here on your path to becoming one. So with that, now I'll pass it back off to Puja and she'll go over some slides.
All right, great. So I'm going to start a little bit kind of at the beginning. So the first ever stethoscope, it was invented and used by a French doctor called René Laennec in 1816. And there were a series of updates and improvements that were made in the mid 1850s, including the development of the 2-ear stethoscope that we know and love today. But since then, there really haven't been too many updates to the stethoscope. I think Dr. Lippmann had some improvements to the acoustic performance in the mid 1960s, which brings us here. So I would argue that ultrasound is really the stethoscope of the 21st century. Although many family medicine physicians, if not most, continue to use the stethoscope, bedside medicine has finally evolved and it's rapidly changing. And we're in the midst of this change. It's really quite exciting. There is some evidence out there. It's not a ton, especially in the realm of family medicine. But this was a good article published in American Family Physician in 2020 that kind of went through the sort key recommendations for practice. As you can see, most of them are grade C, which really is consensus disease-oriented evidence. But there was one A level that was POCUS can rule out ectopic pregnancy by intrauterine pregnancy visualization, and that was through a meta-analysis of 10 studies. Most studies really were done in the emergency medicine realm, and so we're ripe for a bunch of studies coming out. And then a little bit more evidence, or these were position statements from the Society of Hospital Medicine from 2018 to 2019. And basically they said that ultrasound guidance should be used for paracenteses, thoras, central line placements, and lumbar punctures. Really, this reduces the risk of serious complications. It improves the overall success rate, assesses volume and location of fluid, and needle insertion site should be evaluated using color flow Doppler. Interestingly, the Society for Hospital Medicine really did say for central line placement, it recommended using dynamic 2D ultrasound guidance to increase success rate and reduce risk of mechanical infectious complications. This is regardless of providers' level of experience. Which kind of brings us to the new ACGME updates that I think everyone is really aware of and familiar with that were effective since July of 2023. Really, it says residents should have experience in using point of care ultrasound in clinical care. Notice that this is a should and not a must recommendation, because I think it's still pretty difficult to implement POCUS. And that's what we're going to talk about for the rest of it. That's what Ryan's really going to focus on for a lot of his part of this talk. Other things I really just kind of want to mention is some POCUS considerations, right? So POCUS, it helps guide real-time bedside diagnosis and treatment. And it's an adjunct to the traditional history and physical. So it doesn't mean that you shouldn't be doing an H&P. POCUS by itself doesn't really mean anything, but in conjunction with an H&P, it can be very useful. It's an extra tool in your toolbox. It does not replace traditional radiological ultrasound exams. And I think this is a big point I want to make, because a lot of radiologists don't quite know what POCUS is yet. It's still new, and they're worried that maybe that will take away some of their work. And I want to harp that it really doesn't. If anything, from what I've heard more anecdotally throughout the nation, is that with the use of POCUS, it actually increases the amount of radiology exams that radiologists end up getting. And then POCUS is really used to answer binary yes or no questions. So is there an intrauterine pregnancy there? Does this patient have gallstones? Yes or no? Is there cellulitis? Yes or no? Or is it an abscess? Yes or no? And then really, patients and providers usually love it. You end up coming back to the bedside, which is really nice, instead of staying behind a computer. So that is amazing. All right, I'm going to just give out one quick example. So let's say your patient, a well-known patient of yours, 62-year-old male, comes into your office and is just like, doc, I'm having some chest pain, some shortness of breath. I don't really know what's going on. I'm feeling pretty dizzy. So you see him, you take his vitals. He's a little bit hypotensive, a little bit tachycardic. So you're like, as you're getting a history, you have your handy dandy probe in your pocket. You pull it out, you put it on your chest, and this is what you see. And so I think everyone here can kind of see that this here is a heart, and you can see the 4 chambers of the heart right here. And around the outside of the heart is this black fluid. So this is a pericardial effusion. And I think just looking at this, you can tell that this is abnormal. This is a pericardial tamponade. Now you'll never miss that. Here are lots of other examples of when—
Hey, Puja, can I stop you really quick? I think the sound for you is still, so people still can't hear you perfectly. So I don't know if you're able to, I can hear you from my end, but I think to the attendees, it's not coming through. If you could try to talk just a little bit louder.
Sure.
Thanks.
Yes. Let me know if you can't hear me. So examples of when to use POCUS. There's a lot of diagnostic things that you can do. So those binary questions, and also treatments and procedures. I'm not going to go into that in lots of detail, but here are lots of different examples that you can do. Now we're going to move on to some tips on starting a POCUS curriculum. To really get into that, I think we need to talk a little bit about competence, and competence in the setting of point of care ultrasound. When I think of competence in POCUS, I think of it as 4 different steps. And a good way to think of this is really in the setting of milestones. So think of 4 different milestones that somebody has to reach in order to gain competence in POCUS. So 1 is understanding indications and contraindications for ultrasound exams. So that's basic knowledge. 2, you have to be able to acquire adequate images. 3, you have to be able to interpret the images appropriately. And then 4, integrate ultrasound exam findings into individual patient care plans and management. Now, I think most faculty is pretty good at this clinical integration piece. Is that image acquisition that I think is going to be the crux of everything. But really trying to understand competency and POCUS. And those are the 4 things I think about. Which then kind of brings me to privileging. And just to make sure we're on the same page, when I talk about privileging, I'm talking about institutional guidelines to an individual practitioner. And these guidelines are based on emergency medicine guidelines per ACEP. There are no set guidelines for privileging or credentialing in family medicine. The typical numbers that are seen in ACEP are somewhere between 25 to 50 quality reviewed exams in a particular application. So let's say you're trying to become competent in a AAA scan. So somewhere between 25 to 50. And then for general competency, somewhere between 150 to 300 exams. And then for procedural guidance, especially procedures that you're already doing, somewhere between 5 to 10 scans. And then ACEP kind of talks about practice-based pathways versus residency-based pathways in order to gain this competency and then go into privileging. And residency-based pathways is really just what we're trying to create in our residency, a curriculum, so that residents can graduate with competency in a few different applications of POCUS. So the other really big thing I want to talk about is just make the connections in your institution, and that'll really help with creating this POCUS curriculum for you. So does your ER use POCUS? Is there someone that you can go talk to in the ER department? Is there a fellowship program, or is there a residency that you can talk to about how they've implemented POCUS in their curriculum? What middleware software is available at your institution? So examples of middleware are QPath, the Butterfly Cloud is an example, Viewpoint through GE. So really, what is already available? The PAC systems also have a software that you can sometimes use. So ask your institution what there is. And then, do you need to touch base with radiology? Is that going to be a barrier for you to create a curriculum and start POCUS at your institution? If that is, I highly recommend start that conversation early. Go find out who you need to talk to in the radiology department. And then who are people in your institution that may be able to help teach outside of your residency program? So are there sonographers that are great teachers that would be happy to take your residents? Is there a vascular access team? What about OB sonographers or maybe other ER doctors? There's lots of resources in institutions that you can definitely tap into. And then I absolutely recommend getting IT on board early. You're going to need their help to create this integration. And then also there's oftentimes contracts that are already made with different vendors that you should know about, so that you know where to go and buy machines from. So if your institution already has a contract with GE, it will be easier to stay in GE and get equipment through them versus going to Philips and trying to create something with them. And then know your industry reps and institution ultrasound coordinator. They're fantastic, fantastic resources. The other really big thing I want to make sure I talk about is time. It takes a lot of time to create a curriculum and to really get that up and going in a residency program. So if you're able to get dedicated FTE, definitely try to get that. It is super important. Otherwise, it's hard to make something happen on the little free time that you might have. And then if you're trying to learn how to do certain scans, keep a probe on you at all times. Have it in your pocket, have it charged, and scan as much as you possibly can. You know, if you have a no-show in your office and you have a really nice patient that you know, ask if it's okay for you to do an educational scan on them and scan their heart, do a AAA scan on them. See if they'll let you do it, but make sure that is an educational scan. I'll talk about that in just a moment. And then hospital scanning, is really the best for pathology. And that's where you'll learn the most pathology after you know what normal is. There's so many different resources out there for learning POCUS. That this is mentioning that same article I talked about before, but they talk about lots of different resources that you can, I would advocate you going and looking at, and they're free, they're educational. And then really, like I said, just getting hands-on practice is absolutely clutch. And then after that, you really need to make sure you have some way of doing quality assurance. And so quality assurance is really where somebody who is competent in POCUS is able to go through scans either in person at the time of the scan with the learner and review how to improve the scan, what you're doing, and then how you can integrate that in clinical findings. And then as you get better with POCUS, you can review some of those scans later with that same provider, and they can discuss how you can improve the scan or what you can do with it, and then how you can clinically integrate that. And as you continue to improve in POCUS, you can then start comparing your own scans to formal studies. So if you know if you know one of your patients needs to get an echo, ask them if it's okay for you to go ahead and do an educational cardiac scan on them, and then compare that scan to what the formal echo shows. And like I mentioned before, what is an educational scan? It is a scan that's performed by a non-credentialed provider who is learning ultrasound. So generally, I have my residents go and they have a spiel about them doing an educational scan, and the patient will provide verbal consent for it. The biggest point of this is that no clinical decisions will be based on that scan. And then any concerning POCUS findings can be reviewed by a credentialed provider. So, you know, a good example for this is if you're in the outpatient setting and you're trying to scan someone, it's your own patient, maybe don't scan the part of their body that you're worried about. Make sure you finish the entire office visit first with an assessment and plan, and then afterwards go ahead and do a scan. So if they're there for an ankle injury, go ahead and look at their heart, or vice versa. If they're there for some abdominal pain, maybe they'll let you do a shoulder exam on them. You know, there are so many different machines out there these days. There's pros and cons to all of them. The costs vary, but like I said before, really talk to your institution, see what contracts you already have in place, and maybe try to go with somebody that you already have a contract with, and that would be the easiest way for you to get a machine. But like I said, there's lots of pros and cons to all of them. Here are some examples of different machines. And then just some costs for these machines. Really, a basic laptop with 4 probes costs somewhere between $40,000 to $75,000 to purchase, and somewhere between $8,600 to $1,250 per month for a 5-year lease. And a pocket ultrasound somewhere between $2,000 to $10,000 to purchase, and somewhere between $150 to $200 per month for a 5-year lease. So these are just kind of some numbers out there so that you can figure out with your own budget what would be helpful versus not helpful, or what you can actually buy and what you can't buy. All right. Thank you guys. Here are some resources, and I'm gonna hand it over to Ryan.
Okay, perfect. All right, thanks so much, Puja. So now, you know, that kind of lays the background of some of the stuff you need to think about as you're kind of POCUS champion and setting up a curriculum. And now I'd like to shift gears a little bit and build off that and talk about some of the resources that we've been working on over the last several months on to help kind of create some more resources for you guys to become POCUS champions or grow on your already role as a POCUS champion. So the first opportunity, let's see. There we go. All right. So the first one is the STFM POCUS Collaborative. We started this collaborative earlier this year in the spring. And really the goals of this is to create a community or a network of people who are interested in POCUS education. Whether you're already a POCUS champion or you're someone who's aspiring to be a POCUS champion, to get these people together to talk about kind of best practices and share ideas with POCUS education and family medicine. And the next goal with that is establish, how do we kind of foster that communication? So it's establishing a communication platform for educators to share ideas and ask questions on POCUS education. And effectively, like what serves as this is on the STFM collaborative page, there's a discussion board where people can post questions or share ideas or certain tips. our leadership for the collaborative, which is posted on the right side of the slide there. We try to post at least once a month if there's not already a discussion from one of our collaborative members, just to kind of facilitate conversation. Like we've had one about, is it residents being models? Is that okay? And like we're told in the future, bring questions about informed consent, all this stuff. So a lot of those things that you'll think about that Puja mentioned in the previous slides, we're gonna have discussion things on the collaborative. And we strongly encourage people who are starting out a POCUS curriculum to join the collaborative. And they have questions on, hey, how did you do this? What would you suggest that I do here? And just really be a sounding board for people. One of the big current projects that we're working on right now for the collaborative is doing a needs assessment, trying to figure out what do the members want and need, and what can we work together for as a collaborative together on and forming different projects and stuff. So that right now we're kind of finalizing that and waiting for the holidays to get over, and we'll post it after the holidays to the collaborative webpage. And that just really will help us shape our kind of goals, action items, and stuff for the future for the collaborative. And the thing that I'm super excited to talk to you guys about is the STFM Family Medicine Point of Care Ultrasound Educator Certificate Program. So this is going to be a year-long program developed for family medicine educators, taught and developed by family medicine educators. It's going to focus on teaching you point of care ultrasound, but it's unique in the fact that it's going to teach you how to be a teacher in point of care ultrasound. So the goal of it is to create POCUS champions. So we're going to do a mixture of hands-on training, online learning, and longitudinal experiences, and really trying to provide a high-quality experience at an affordable price. I'm going to briefly go through all the components here on this slide, and the rest of my PowerPoint kind of dives into them a little bit more. So with the certificate program, there's a workshop component. There'll be 3 workshops that you attend over the course of the year. They're all in conjunction with the STFM conferences. So we have the introduction of point of care ultrasound, advanced, and then we're doing an online POCUS educators conference. There's going to be mentorship throughout the year in the program. There'll be monthly educational review sessions. And these really are just teaching you how to give feedback to your residents on their images. A lot of your role as a POCUS champion may be meeting with the resident after the scan already happened, and they're asking you, hey, what do you think of this? Or can you review some of my images? And teaching you how to do that. Image portfolio, we all know a big part in developing an ultrasound is someone giving you feedback on your images, having someone look to see how you're doing and what you could be better on in image acquisition. So we're hoping to achieve that here through an image portfolio. We are we're in the thick of creating modules right now. We're actually filming them this weekend. We're all super excited about. We'll have 10 different modules that all be case-based, and I'll talk about that more shortly. And then at the end of the program, there'll be an assessment. We'll do a written assessment and also a hands-on assessment. So when we sat down to think about this certificate program and where we wanted to go with it, we kind of asked that question of what should every family medicine doctor should know, or what should every graduating third-year resident should know in point of care ultrasound. We kind of boxed it into these 9 core content areas. I know there's probably other modalities that you all are using ultrasound for right now. They're not listed here, but starting out with these 9 core content areas. And then from there, and Puja had a slide on this earlier that talked about with competence of as you go through ultrasound and how you grow. And we kind of use that model when we were talking about developing the scope and implementing these 9 core content areas. So phase 1 is really focusing on ultrasound fundamentals and obtaining images. So that's where we're really going to initially focus on that before you go on to the next phases. So that is going to be done through the introduction workshop, modules, and the image portfolio. After you get a foundation, you start thinking about learning normal versus abnormal, and that's where our advanced workshop comes in. Modules again, image portfolio, mentorship, and educational reviews. And then finally, we want to get you to a level where you're integrating POCUS at the bedside and you're teaching POCUS at the bedside to your residents. And this is the advanced and educators workshop, modules, image portfolio, education review, and mentorship. All right, so now I'm just going to dive into each of the components a little bit further. So for the workshops, we have the introduction of point of care ultrasound workshop. This will be at the annual conference each year. It's been, some of you attendees on here might have actually been to one of the POCUS workshops at the annual conference. It's going to be pretty similar to that. We're doing some changes just so it fits in more longitudinally with the rest of the certificate program. But really there, it's going to be the basic knowledge and foundation of point of care ultrasound to set you up for the rest of the certificate program. So really going to focus on a lot of that phase 1 learning. We'll introduce some phase 2. And again, this will be a 2-day pre-conference workshop at the annual conference. And then in the fall, we'll come together and do our advanced point of care ultrasound workshop. We'll review some of the phase 1 stuff very briefly, but the main focus there will be on that phase 2 and phase 3 learning, where we're going to do a ton of more clinical application and integration and teaching you how to teach point of care ultrasound. Because that in itself is a whole nother skill. You may be the best ultrasonographer and get the perfect views, but you may not know how to teach it. So we're going to really kind of focus a lot on that there. You need to complete the introduction before you do the advanced, and this will again occur at the CPQI conference. And then the last workshop to kind of round out the workshop series will be an online workshop sometime in this like the late winter, early spring. And this is going to be a 8-hour virtual offering where we're going to talk a lot about being the logistics of being a POCUS champion. So we're not necessarily going to talk to you about, hey, how do you get a parasternal long, or how do you get a view of the kidneys? It's going to be, hey, how do you set up a curriculum? How do you decide what ultrasound machine to get? How do you put together a proposal to get an ultrasound machine? Like all those logistics that come into being a POCUS champion is going to be the real focus of this workshop. And then the modules. So the modules roughly are going to take probably 30 to 45 minutes per module. It kind of depends on the topic. Your AAA may not take as long as cardiac, for example. There's going to be a mix of videos and text with embedded knowledge questions. And what we're doing is those 9 core content areas that I mentioned before, each of them are going to have a clinically based scenario that's going to help frame the module. The 10th module is just going to be an introduction module where we'll go over a lot of the terminology and stuff like that. So how are these going to look? So each module is going to follow a pretty similar template where they're going to talk about performing the ultrasound exam, go over and establish what is normal, introduce pathology images as it relates to that particular case. And what we really want to do is walk participants through how to do an ultrasound exam. So for example, I am developing the pulmonary case, and what we're doing, and that we're filming this weekend actually, is we're going to have a simulated encounter with a standardized patient, a resident, and an attending physician. For the pulmonary case, the patient's going to have shortness of breath. The resident wants to do a lung ultrasound. So we talk about, what are some things to talk about before you go into the exam room with your resident on ultrasound? What does that encounter look like? So the attending is actually going to be talking the resident through the ultrasound exam. We're really sharing images at the same time. And then, subsequently, they're going to find a pathology in this shortness of breath case, and they're going to talk about that. And then we're going to have a clip where, what are some things that you can summarize with your resident after the ultrasound exam? So what we're trying to do with that is not only teach you how to do that ultrasound exam through this, but give you tips on how you can teach your residents to do this. So really trying to take that twist with these modules and have them all be case-based. They're all based around like a patient presentation and case, to try to think about it that way, to get you guys thinking of how you can use ultrasound more clinically too. And all throughout the modules, there's going to be tips on teaching pearls. And I'm excited to announce, initially the STFM modules were not going to be free, but we actually decided there was such an excitement for it that they're going to be free to all STFM members. So everyone on this will be able to have access to the modules. Will be next summer when they come out. So going on with the certificate program then is the mentorship. So we have a set of core faculty, and I have a slide later that shows who our core faculty are. But each core faculty would be assigned a group of mentees. And then really that's your point of contact throughout the certificate program. We're going to set up some communication platform. Right now we're thinking about using GroupMe, where you and a couple other people in the certificate program are in a chat with the one of the core faculty, and you can use that to ask questions, share ideas, even share images, just whatever, just somebody to have as your point of contact as you go through and mentor you through this year. And then the education reviews. So these will be 2-hour sessions. They're going to occur once a month. There's going to be 2 of them a month, but there's only one topic with them a month. So there'll be monthly sessions that you'll have to do as the participant. They'll be all virtual. Each session will have a topic. So for example, it'll be cardiac or pulmonary. And then the sessions are going to simulate similar to a pass the pointer session. So how this would look if I was a participant in it during like a pulmonary one, each participant would be responsible for bringing their own pulmonary images. They would present their images, then the other certificate participants on that Zoom would give feedback and interpretations of that image. So they get practice of, hey, here's an image that your resident may bring you. How do you fine tune that view? How do you tell them what's that pathology? So not only are you getting to see multiple ultrasound images, you're getting tips on how do you give feedback to optimize that view, then also some tips on pathology. It's just going to help kind of equip you with the skills to do that with your own residents is the goal through these education reviews. Image portfolio, we're still kind of deciding the exact numbers. There will be, for example, you would need to upload more cardiac and lung versus some other ones. Maybe like soft tissue is not as difficult. You won't have to upload as many as you would for the other ones. We're also deciding that having people upload images for all 9 areas may be not fair to people who don't do any OB ultrasound. So how can we expect them to upload images there? So we were thinking of 6 of the 9 core content areas. There will be some of these that will be required, and then we'll give people the option to choose a couple other areas to upload. And then to wrap everything up at the end of the certificate program, you'll do a written assessment, which will be a 50-question assessment, where a lot of it's going to be that image interpretation and application. This will be an online format. And then taking place at one of the workshops will be like after the workshop's complete, would have people stick around a little bit to do this hands-on assessment. But really it's going to be like a OSCE-based thing where you go in and be asked to obtain, maybe a heart view. You go in and get a peristernal long, peristernal short, whatever the case asks you to do. And then your instructor may show you some pathology images that you would have to interpret, is the goal for that. Really just testing your ability to obtain images and also interpret images. So this, as you can imagine, all this work has not been done individually. There's been an amazing team that's been working on this. As you can see, Puja's on this list here as well as our core faculty. These are our wonderful core faculty. I've been working super, super hard since June on putting all this stuff together. They'll be the main contact points and the main people you interact with during the certificate program. We also have 10 faculty instructors who are going to be helping out with our workshops and helping out with our educational review sessions. All right, and then that is all I had. This QR code here will take you to the website, or you can just go stfm.org/POCUS, or live today actually is a new banner right on the homepage of the STFM website that you can click, and it brings you right to the information page for the certificate program. We'll also, under the webinar section, there'll be links for this or resources, and we'll post a link there to how to add yourself to the POCUS Collaborative, but you can do that through the STFM Connect page, but we can send a link there as well. Then I think at this time, what we'll do is actually I know there's been questions been asked throughout, and what we'll do now is close out of the PowerPoint, and then we'll open this up for more questions. I know you all are muted, so utilizing the chat form, and we'll go through them and answer all the questions you guys have.
To answer this first question of is POCUS billable for family medicine? Yes, it is billable. I do bill in the outpatient setting for POCUS. And is there concern that it might be adding cost? It's possible if you're doing a POCUS exam and then have to get another formal exam through radiology. But it also, I've had it to where it decreases it significantly as well, right? So if a patient comes in, so a DBT scan in the outpatient setting, if it's positive, then it's positive and you start treatment there. Or if you're looking for an intrauterine pregnancy and you see it, then that stops a patient from going to the ER. And I do bill for those. And then as for what do we expect STFM cost to be after the free period? I don't know, Ryan, do you want to answer that?
Yeah, so when you mean the free period, I'm assuming you're referring to potentially the modules. The modules will always be free. And one thing that we hope to do is keep the modules updated. So they're built in a way that you can add more cases to it. So we hope to keep those updated and be a valuable resource ongoing, not just like a one-time thing. And my understanding is they'll never have a charge to it. Let's see. So scrolling through you've answered this, but what is the cost of the course? So the cost of the course, so everything included in there is going to be $4,500. That does not count travel or anything like that, but that covers like the workshops, the mentorship, the educational reviews, the image portfolio, which I know seems like a lot, but like when we compared it across to other programs, it's actually, we're providing more services and that at a cheaper price too. It's just a lot of this stuff, coordinate all this stuff. That's kind of what we had it shook out to be the cost of the certificate program. How are participants expected to attain images? What tools are needed? Yeah, so a lot of ultrasound machines. So one has like a USB in the back, so you can plug like a USB in, save your images on there, and upload it that way. That's how I do it on most of our cart-based machines. And a lot of the handheld machines don't have a cloud you'd be able to download it to. It is we do expect. And I know this will be limiting some people in order to apply, but just to get the most out of their certificate program, we do ask that you have the ability to have a machine that you can either save images on a USB or some handheld like a Butterfly. You can get it from the cloud that we can look at the images. Otherwise, you would not be able to fully participate in the image review.
I don't think that there's a preference necessarily on what handheld to purchase. I think that really depends on you and the institution that you're with, and what contracts you might already have with other vendors. So I think it depends. There's pros and cons to every single ultrasound machine out there.
And then how much CME can one get? I know the CME details are being worked out. Jenny or Brian, I don't know if you guys would be able to chime in on that one.
Hi, this is Brian Hischer with STFM. So we currently don't have any information on the CME yet, but as soon as we do, we'll put it on the that POCUS landing page on the website.
So as far as eligibility to apply, yeah, I would say, our target people are residency faculty, but I wouldn't say like somebody who's a resident who's like, hey, I'm in my residency, I know I want to do academia or teach at some residency program afterwards, and I want to be a POCUS champion. Those type of people can definitely apply as well. Core and, as our next question, core and teaching faculty both can apply. Anyone who's passionate, excited about teaching ultrasound. Do you want to take a stab at that one, Puja? I can talk about
Sure. I think so. For suggestions for sustainability of trained faculty, I think the number one thing you can do is make sure you have more than one faculty member trained, and then teach the next generation. So teaching your residents and then potentially keeping them on is where I've really seen it work in the past, and what will be, I think, the easiest, honestly, because faculty don't tend to not have a lot of FTE in order to learn this new skill, especially when they're really busy doing other things. And so I think if you teach the residents, and then hopefully one of these residents wants to stay on board, and that'll continue, it'll just continue the education going forward.
I would second that. And that's what we kind of done at UNC. We had one faculty that did it, who kind of took me under his wing, and then I stayed on, and now I'm training a couple other, like our chief resident next year is staying on. I spent a lot of time this year with him on ultrasound, and it kind of just grows from there. I do think residents I don't know if it's just because the fact that they're training and learning still, just easier for them to pick it up in their practice. I just seen a lot of our faculty try to pick up ultrasound, and it just comes a lot quicker and more natural to the residents. I don't know if it's why the structure of that is, but I would second, like, train your residents to stay on afterwards can be really helpful. The certificate program will kick off next May at the annual conference. And then this year the first year we're doing less than what we will be doing once we get it up and running fully. We're doing 18 people this first year, just kind of see how it goes. And the following year we'll work our way up to 36.
And sorry, the question for that was how many participants are you accepting? And that'll be 18 for this first year.
What other questions do you guys have? Anything related to POCUS or POCUS education or the STFM resources? I think a lot. I mean, we have about 120 some members on the collaborative already, so I encourage you guys to join that as well. Some good discussions on there.
Brian, do you mind just kind of showing people where they can find the link?
Yes, so let me see if I can reshare my screen out here. All right, is my screen shared now to everyone?
Yes.
Perfect. So this is right here on the STFM homepage. So right here, as of today, live is this lovely banner link here that you can click on. And we'll continue to work on this and update this. But this gives you a little bit of information about the certificate program, kind of a summary we talked about today. It has the benefits and then program components. This also lists the schedule. So applications are officially open today. And then people will find out mid-March. And then these are the dates of the introduction pre-con workshop. And here's the date of the advanced workshop. And we're still kind of setting the date on that POCUS Educator workshop. Here it talks about the cost and how to apply. And this will bring you right to the application and stuff. The application just has, some questions of like where you just click on stuff and list, and there's a couple of short answer questions on there as well. You will need to have a letter of support from either your program director or your department chair, just because we recognize attending 3 workshops in a year can be time consuming. One of them is virtual, but still attending 2 conferences in a year can be time consuming. Or getting your images and attending these sessions can take some time. So we just want to make sure that your program would support you in that. Then as we update this too, we're going to have list our faculty here as well, and just keep adding and building to this website.
Brian, so there's a question of how is the mentor going to be selected?
So yeah, it's a good question. So we haven't really decided how exactly we're going to pair up people with mentors. One thing we thought about if there is some regionality to it. So, I'm here in Chapel Hill, North Carolina. If there's somebody who lives within an hour, maybe does that person come my mentor because you maybe meet together in person. So some thought there. Otherwise, we haven't really decided too much on how that would be broken down yet. But I think if people had preferences of looking at the core faculty, who they would want, we would be willing to kind of work and see what we can do.
are we able to pick up a core faculty for learning? I don't think I fully understand that question, Ryan.
Core faculty for learning. No, I mean, could you retype it? Maybe clarify a little bit more in the question.
While we're waiting for that, is there going to be more outpatient or inpatient focused? Ultrasound guided MSK injections would be great to learn.
I think the goal, I mean, there's a lot of overlap between the two. I feel like, yes, there are definite things that are more inpatient focused than outpatient focused. The goal is to overall be outpatient focused. All our modules are set based like in a clinic room. And there is a case where we will talk about MSK injections of the knee.
This is Brian from STFM. I see that we have an attendee with their hand raised, and I will go into the interface here and allow that attendee to ask a question. Okay, Michael Lamb, you can ask your question.
Sorry, I think I might have clicked that by mistake. My apologies.
No worries.
Here's another question of how is the evaluation going to be?
So assuming if you're alluding to the evaluation at the end, like the assessment, there'll be the 50 question written assessment. I guess written must be done online. We are actually exploring just to having people do that on their own and not have to do it like at one of the workshops or something. A lot of it's going to be, you see an ultrasound image, or you may have a case that shows you some ultrasound images. How do you clinically, like, testing your ability to integrate that image clinically? More so those questions rather than showing you like, hey, here's a picture of a phase array probe, like what type of probe this is. More of just like integration type knowledge. And then the hands-on part of the evaluation will be taking place where you'll have a standardized patient. You'll walk in, your instructor would tell you, hey, can you please, this is the case we have, what ultrasound views would you want to get? You get your ultrasound views, kind of check off that you can obtain those views, and they would then show you some images that you would interpret. Does anybody else have any more questions? While we're waiting to filter in any last questions, I'll just summarize the resources on STFM. So again, you can go to the STFM Connect page to join the POCUS Collaborative. We'll have a link available underneath this webinar when it's posted. The modules are part of the certificate program, but also going to be something available to all STFM members. You don't need anything special to get that other than a membership, and those will be posted next summer. More information on that stuff to come and how you access and get those. And then lastly is the certificate program, taking 18 applicants this year. Applications open today, and that will kick off starting at the annual conference in May.
Great. And Ryan, when should they expect to know who got selected?
Yeah, so we're planning on sometime in early to mid-March, recognizing that you need to start thinking about if you're going to go to the annual conference or not. So our goal is to kind of review everything in February and let you know the first part of March. And the application period is going to be open until, we have the exact date here on the website, in February. Let me pull it up here. We have it open till, yeah, we have it right now in February. So it'll probably be like that first week of February. We'll post February 23rd, actually. And then we'll review them at the end of February, first part of March, and let you guys know.
Thank you guys for joining us.
Thank you so much, Dr. Dalal, Dr. Paulus. We appreciate you giving us your time today to talk about how important POCUS is for family medicine and for all the resources that STFM has to offer. You are welcome to email with follow-up questions to jminor@stfm.org. And this recording will be available to you safely starting tomorrow on stfm.org/webinars. So thank you so much and enjoy the rest of your day.
Thank you, everybody.
Thank you guys.